Hi, this is Dr. Maggie Perry with Tell Me What You're Proud of. In this series of short lectures, you'll learn about the core principles for overcoming an anxiety disorder and OCD. In this lecture, we'll discuss the therapeutic attitude of willing acceptance. Anxiety disorders are created, maintained, and intensified by avoidance and are overcome with approach and exposure. Identifying and observing the details of your anxious moment will help you know what to do, what to challenge, and how to do the opposite of avoidance. Let's start with understanding the difference between an anxiety state and an anxiety disorder. An anxiety state is a normal, natural, healthy, and adaptive reaction to a threat or perceived threat. In the presence of a perceived threat, we get anxious sensations, the fight or flight response, as well as catastrophic thinking. Your fight or flight response might include an increase in heart rate, sweating, blood rushing out from your stomach to your arms and your legs, an increase in blood pressure, pupil dilation, and muscle tension. In the presence of muscle tension, people often take deeper breaths. As you breathe out, you experience a change in CO2. This is not dangerous to you, but it can make you feel dizzy and tingly. In addition to the fight or flight response, people often experience catastrophic or worry thoughts. The various anxiety disorders are marked by the difference in the content of the fear. For instance, in the presence of the fight or flight response, some people will fear their sensations and then avoid um, in response to those sensations. We call that panic disorder. Some people fear the feeling of judgment, rejection, and embarrassment and avoid in response to situations that would trigger those experiences. That's called social anxiety. Generalized anxiety disorder and obsessive compulsive disorder can be seen on existing of us on a spectrum of thoughts from egosyntonic to egodystonic. That's just jargon for what seems reasonable versus what seems unreasonable to the person having the thoughts. So a generalized anxiety, egosyntonic worry thought might be something like, what if I lose my job? And the avoidance behavior and response might be checking and rechecking work email, getting reassurance from a boss or coworkers, or overworking. Comparatively, an OCD, egodystonic thought would be something like, what if the door isn't locked? Even when a person just watched their hand open or lock the door, and that this thought could give them the feeling of uncertainty. In the presence of the feeling of uncertainty, the avoidance behavior could be checking and rechecking the door, taking a picture of the door, getting reassurance from a friend that the door is locked. All of these responses are examples of avoidance behaviors. Avoidance behaviors function to temporarily reduce discomfort, but just create more and more uncertainty over time. When you do something in response to a feeling of uncertainty, it makes the feeling of uncertainty more likely to occur in the future. If that becomes a frequently used behavioral pattern, we call this an anxiety disorder. In order to get through anxiety disorders, you have to do the opposite. It's very important to identify the specific avoidance behaviors that you're engaging in and then specifically choose to do the opposite of that avoidance. That's the basis of exposure exercises. Exposure and response prevention is the main technique used to overcome anxiety disorders and OCD. What that means is exposure as the opposite of avoidance, and then response prevention, meaning not doing any of the avoidance behaviors. So the spectrum of your response to anxiety can range from avoidance to exposure. The belief of a person who avoids is that he or she is in danger. In contrast, the belief of a person who exposes herself to the anxiety on purpose is that anxiety is an opportunity to learn. What we're trying to do is teach ourselves that anxiety is an opportunity to learn. So, exposure is the willing act of putting yourself in psychological and physical situations that will induce fear and anxiety so that you can learn over time that you can handle it and that you don't have to avoid. Willing exposure is challenging in the moment of anxiety, but in the long term, it will decrease your anxiety. There's a couple different theories about why this works. One theory of why exposure works is habituation. This theory understands that the fear response is similar to all other senses. For instance, if you were to enter a room that smelled distinctly, if you stayed there, after a little while, your sense of smell would adapt to the smell in the room and stop notifying you of the smell. If, on the other hand, you left the room and re-entered repeatedly, you'd notice the smell anew each time. In the first situation, you are habituating. In the second situation, you are not. As this relates to anxiety, the theory is that if you expose yourself to the fearful stimuli until your anxiety decreases, over time you'll become less and less anxious when presented with the trigger. Another more recent theory suggests that habituation isn't as important as willingness to have the sensations, thoughts, and behavioral urges that accompany anxiety. Willingness is important because of the cognitive component of anxiety. Unlike your sense of smell, which habituates regardless of what you think about the smell, anxiety increases and decreases based on how you interpret the situation. That is, if while your heart is beating quickly, or while you're having unwanted intrusions, or while you're crossing over a bridge, you think to yourself, this is really dangerous, or something equivalent, your brain will pump more and more of the fear response through your body and you'll feel more afraid. Again, this is unlike your sense of smell, in that even if you thought the smell is really bad, you would eventually stop noticing the smell. The way in which cognitive interpretation influences the fear response is called anxiety sensitivity, or second fear. Anxiety sensitivity is the part that's responsible for the anxiety disorder, not the anxiety state itself. Thus, exposure in and of itself is not sufficient for overcoming anxiety disorders. Exposure must be done in the right way. Exposure is done the right way when you understand the point of the exposure and you willingly expose yourself to the possibility of anxiety with the belief that experiencing anxiety will actually help your body learn that you're not in danger over time. Frequently, if you try embodying this attitude, you will not feel anxious. This attitude effectively conveys to the mind that it's not in danger. Sometimes you might start trying to trick your mind into wanting anxiety when you truly don't prefer to have it. This is a common experience in the process of exposure and response therapy. You might expose yourself to your anxiety and get quick relief. Then, if you still really fear whatever it is that you're triggered by, it's likely that your anxiety will come back or pop up at different times. The problem there is that you can't trick your own mind. So the attitude of willing acceptance towards thoughts, feelings, and behavioral urges that occur with the fear response must be authentic for long-term relief. Again, as we're talking about the therapeutic attitude of willing acceptance, the major concept is that anxiety disorders are created, maintained by, and intensified by avoidance, and that willing acceptance of the thoughts, feelings, and sensations will not only give you relief in the moment of anxiety, but over time, you'll stop thinking that those thoughts, feelings, and sensations are threats, and you'll stop feeling anxious.